Well, thank you all for coming out. My 15 minutes of fame is rapidly drawing to a conclusion here, so thank you. This is the culmination, but I appreciate you coming out. And I just wanted to go today through a little bit of the history of sinusitis, the magnitude of the problem, some of the past treatments, and some of the new innovations that have come up here. So, again, we'll start here. And basically, just as an overview, when you talk about sinusitis, you're basically talking about an inflammation of the upper airway, including the sinuses, which can be either viral or bacterial. The overwhelming majority of the time, these are viral type of infections that run their course, usually after 7 to 10 days, and then resolve. But those that tend to become infected with bacteria represent a small percentage of those patients, but they are problematic issues. And what happens with the sinusitis is that the lining of the sinus tends to swell, and you'll get blockage of the opening from that sinus into the nose. And when that happens, you'll have complaints of nasal congestion, facial discomfort, discharge from the nose, headache, and just generalized fatigue. And we divide sinusitis into two different categories. You have the acute phase, which occurs after the viral upper respiratory tract infection. It generally will last less than 4 weeks and usually responds pretty quickly to antibiotics, decongestants, and other medications to try to help open up the nose. And those patients that go untreated or inadequately treated, those patients can develop symptoms of chronic sinusitis, which is defined as persistent symptoms that go on beyond 3 months. As far as the magnitude of the problem, it's significant. It affects, close to 40 million people a year. That makes it one of the more common health problems in the United States. And, most of those patients clear. But of those 40 million people that have acute sinus infections, about 7 million go on to develop chronic symptoms. And again, these are tough to distinguish from viral upper respiratory tract symptoms or acute sinusitis because the symptoms are the same. Again, congestion, facial discomfort, discharge, headache, teeth pain, and sometimes your ears will become secondarily affected because it has the same type of lining in it as does your nose and sinus cavities. I'm getting the signal. Is this any better? Okay. All right. All right. All right. Excuse me here. I got to get my... Yes, it's tough, isn't it?
You're not trained in the right way.
Yeah, I'm sure you have more experience in pinning this up than I do.
No, go help them.
All right, what are we doing here? That little thing. Okay.
I think it gets clipped to my ear, doesn't it?
It does.
Okay.
There you are.
Okay. All right. I'll try to speak up at this point then. Again, just about the magnitude of the problem. Chronic sinusitis, more prevalent than heart disease and asthma. And because of the number of people affected, it has a greater impact on the quality of life than a lot of other medical problems, such as heart failure or back pain. And, the symptoms, although they're not life-threatening, they affect people significantly, and there's an emotional component to it. And so, it results in 20 million office visits a year. Well, one of the questions that was posed to me, and I don't have a great answer, is why do we have sinuses? I'm not sure anybody really knows the answer. There are a couple of theories. One is that it creates these air-containing cavities in your head that lightens your head, so that your neck doesn't have to support quite as heavy a load. And the other theory is that it forms kind of a bumper for your brain, so that if there's trauma, you get kind of a crumple zone that protects your brain from significant injury. But they're air-containing spaces that are lined with a very specific type of lining that creates mucus, and they have hair cells on the surface of the cells that propel that mucus out of the sinuses, into the nose, and down into your throat. And what the purpose of the sinuses are is to help warm and humidify air that you breathe. And also that mucociliary blanket with the hairs catches viruses and bacteria that come in through your upper airway and basically neutralizes it and pushes it down the respiratory or the digestive tract, so that it has a function, an immunologic function there. And each of these sinuses has an opening that allows the mucus to drain into the nose. And those openings have to remain open in order for the sinuses to work effectively. So what are your treatment options if you do develop a sinusitis? First and foremost, sinusitis is treated with medicines first. 80% of those people that come in for a sinusitis are treated with medications and require no further treatment. And of medications, antibiotics, a wide variety of them are used. Topical intranasal steroid sprays, which are often used for allergy issues, but are helpful in reducing swelling of the lining of the nose and helps relieve some of the obstruction from the openings of those sinuses into your nose. Things like neti pots or saline rinse are great options to help clear some of that debris. Inhaling steam helps decongest matters, but despite aggressive medical treatment, 20% of these people won't respond to medications, and they go on to further treatment. So, if we look at the things, or the magnitude of the problem, 37 million sinus sufferers, 7 million of these patients develop chronic problems. They go for medical treatment. 80% of patients are improved. They don't go any further along the paradigm than that. Of those people that respond to medical treatment, the remaining 20% will see somebody like me and talk about what other options are available to them at that point if they've failed medical therapy. And so you have 1.4 million people that come in for surgical evaluation. And a large percentage of them decide that they don't want to have anything further done. And I think part of that reason is because everyone in this room has stories of their own or family members that have gone in for sinus surgery and walked out with horror stories that nobody wants to repeat. So, a large percentage of them have declined. And then they begin again. So when they decide not to do anything further, their problems recur, they go on antibiotics, and I see those patients that have been treated with multiple courses of antibiotics, been on multiple sprays in their nose, have been allergy tested without too much improvement. And so, they just get caught in this spiral or this circle here. And so, this is why most people have decided that they don't want to have anything done. This is what I was trained to do a long time ago. Despite my boyish face here, it was a while before I was in residency training, and we used to do procedures like a Caldwell lock, where you would lift up the lip, puncture into that sinus, take down the wall, take out the lining of that sinus, with the idea that you had to strip that lining out because it was diseased and would not revert back to normal. There are other procedures to address other of the sinuses where you make incisions on the face, and again, the principle was the same. You open up into that sinus and you take out the diseased lining. Beginning in about 1983 to 85, the idea of functional endoscopic sinus surgery was introduced, otherwise known as FES, which was a little bit more particular, or a little bit more exacting, using endoscopes or rigid telescopes You would work inside the nose, find the natural opening of that sinus, enlarge that opening, ventilate and drain the sinus, clean it out if it needed, and it was not nearly as difficult as previous open procedures that had been done. But even the functional endoscopic sinus surgery had its limitations. So it was a big advancement. Patients recovered quickly, but you did use rigid instrumentation. You did have issues with bleeding. Many times you needed to have packing in the nose. And one of the problems that I found from my standpoint is when you did open up into these sinus cavities and you created a raw area in the nose, sometimes you would get scarring that would narrow that opening and it would close. And so about 15% of the time, patients would require some type of revision surgery because the opening that you made had closed. So although better, it was not a perfect system by any means. So we keep looking. And in probably 2005, as it says, we had the introduction of balloon sinuplasty. Similar to the idea that's used for cardiac surgery where they'll thread a balloon into cardiac arteries and dilate them and take out plaque. This is a rigid balloon system that's introduced into the opening of the sinus cavity, and the balloon is used to enlarge that cavity. And as you can see, as we go further along here, the trend in the sinus surgery is that less is better. We want to preserve the lining in that sense. We don't want to strip it out, as I was told almost 30 years ago. We want to try to preserve the lining because it is a specialized lining that has a special function. And so with the advent of the balloon sinuplasty, just to kind of go over things again, you have, close to 40 million patients that are suffering with, sinusitis. The overwhelming majority of those clear with medical treatment, but you still have a significant number that have not cleared. And of those patients that haven't cleared, you'll find that, a certain percentage of those go on to endoscopic procedures. And of those people that are eligible for an endoscopic procedure, balloon sinuplasty may be an option for a lot of those people. Not every one of them. There are disease processes that take place in the nose where patients have large nasal polyps, tumors or growths that would not be amenable to balloon sinuplasty. But for most issues with chronic or recurrent sinusitis, the balloon, I think, is a very viable option for these patients. And what happens in this procedure, and this is a schematic drawing, and hopefully you can kind of see we put a patient picture next to the schematic drawing, but working in the nose, you have a guide, and what you have is a lighted probe that is threaded through the swollen opening into your cheek sinus that's depicted here, this being a little bit of pus or debris. And so what we see here is with that lighted probe, there's a little glow in that cheek that suggests that we're in the right place, so that confirms our location. And then over here, using the lighted guide as a probe, we thread the balloon over that through the opening into the sinus so that it stents that narrowed opening open there. And you can see the balloon going into the maxillary sinus ostium or the opening. And then they inflate the balloon, which pushes this area open. It just dilates it open. And you can irrigate through this catheter, wash out some of the debris that we see here. And then as you remove things, you have an enlarged opening into that sinus. We really haven't taken any of the lining out. And basically what that does is allow that sinus to become aerated again. And as it does, the lining of that sinus reverts back to a normal function and is able to clear mucus and pus from the sinus again. This is basically the same drawing working through one of the endoscopes. This is a structure called the middle turbinate, and you put your probe to the one side of the middle turbinate, and there you see that the balloon is going into the natural ostium there. It's inflated, and then the balloon is deflated, and you can see the opening that it's made. And where we had very little opening or a swollen opening, we have a now widely patent opening that is lined by the same lining that's there. It hasn't been damaged. And so I think this represents a big option. With the endoscopic procedures, as I made this opening before, I would have to take instruments and take out bone in that lining. And so you had a circumferential raw area here that would tend to narrow with time. And the balloon can be used in a variety of different sinuses here. The last few slides have shown the maxillary sinus or cheek sinus that's been dilated. But you have a sinus in your forehead called the frontal sinus, which again, you can thread the balloon up there, dilate it, and you'll get an opening like this. The sphenoid sinus, which is in the very middle of your head, again, you find the natural ostium, place the balloon, dilate it, and you get a nice opening that you can readily see with your endoscope. And so, in summary, again, most people that will come in to see their family doctor or me are going to be treated with medicines, including antibiotics, intranasal steroid sprays, decongestants, and saline sprays. In those patients that fail to recover, then sinus surgery becomes an option. And depending on the pathology, either an endoscopic procedure or the balloon sinuplasty may be an option. And one of the things that I find with the balloon sinuplasty is I find it's a great alternative for patients that may have limited disease or who I may not want to be terribly aggressive in sinus surgery. You know, particularly with the sinus that goes up into the frontal area. With standard endoscopic techniques, there's about a 15% chance of getting that area to narrow, and that becomes problematic. The incidence of stenosis or narrowing with the balloon sinuplasty is extremely small, close to zero. And so those are patients, if they have recurrent episodes of sinusitis that clear in between, I think this is a good option to offer patients. It certainly can be used for chronic sinusitis. Some people don't tolerate medications. They can't take antibiotics. It causes stomach upset. And so, you know, this becomes an alternative for those that may not tolerate medicines or who are tired of taking medications on a regular basis, and that's where patient preference comes in. And as far as the balloon sinuplasty, again, I think the risk profile with this is extremely good. There have been multiple studies that have looked at this from multiple centers. The patency rates for the openings we make are probably 98%. They're extremely high. And the safety profile or the complication rate is very small. These patients often can come in, they can have the procedure done, go home without any packing. The trend has been to try to do these procedures in an office setting. And that's where things are headed. It's becoming less is more as time goes on. It does have reduced bleeding. We often don't have to use any packing. Patients get back to work, school, or whatever they do in a faster time. And you haven't burned any bridges. If you end up doing the balloon sinuplasty and patients still have issues, you can go to more conventional techniques and expand upon that. And so I think this has been a big addition to the armamentarium we have to try to treat sinus disease. I'll open things up for questions at this point.